the job comes with. And I think this is probably the most support I've ever received as a doctor in almost 5 years.
Is this from externals or internally?
Both at work and externally, strangers, people. And I think that was really highlighted during the peak of the pandemic, where most people didn't go to work, were at home, and you have people like us, nurses, healthcare workers, who are having to go into hospital and expose themselves to something they really don't need to. And just the level of support that has come with it has been completely mind-blowing. And it's made me appreciate my job a bit more as well, actually.
I think people are starting to appreciate healthcare workers a bit more now, because they've been put in a predicament whereby they realize that you're putting yourself at risk. Because some people described it as like seeing soldiers go off to war, knowing that they're defending you while you're at home in your comfort zone. So, but let me ask you one thing about like the appreciation. How did you feel about the clapping? Because I've had mixed reviews.
Don't get me started about the clapping.
And there's a reason why I'm asking you this. So I remember one time I was dropping, I'm going to say Lady A. It's a family relative, because they definitely don't want me to say their name. And as we were driving up towards the hospital, there's a roundabout. This is locally. There's a roundabout by the hospital. By the roundabout, there was these 3 guys that used to stand there every morning. So as you're going around the roundabout, they're just there clapping, screaming and shouting at all the healthcare workers coming in. And she was like, when they go inside and have conversations about these guys clapping, they completely hated it. Like, it wasn't something they enjoyed because it became too much in your face. I understand the sentiment behind it, but sometimes the actual approach could be a bit off.
For me personally, I just thought the clapping was a bit superficial. You know, there's so much that can be done within the NHS, so much that can be done for healthcare workers. And it's only just recently that the wages of most healthcare workers has risen beyond the rate of inflation. And the clapping was started by the government, you know, clap for the NHS, whereas it's the same government that's done things, that's made austerity cuts to the NHS and to healthcare workers. So I just thought it was a bit superficial, and it's just BS, to be honest with you. There was no need for it. If we're going to do something, let's do something tangible. Clapping doesn't pay people's wages. Clapping doesn't, you know, pay nurses' wages, pays doctors' wages. It doesn't do anything.
So you feel the support from the actual general public was more genuine and more like impactful than the government's initiatives?
I think the government initiatives, it's publicity. Even just now, they've just announced that they're giving people pay rises, whereas there's pay rises that have been agreed upon 2 years ago and 3 years ago. These are things that have been agreed upon.
But these being backdated? Or?
Yes. So nothing's been backdated. So
but will they backdate? Is that part of the incentive?
What, sorry?
Is that part of the incentive to backdate the payments?
No.
For real?
No, it's all publicity. It's all press. So I think one of the examples was, doctors are going to get a pay rise. Well, actually, what they forgot to mention is that excludes junior doctors, who make up 90% of doctors. They've already agreed a pay freeze 2 years ago, just to keep their rate of pay along in line with inflation. And the people who are going to get a pay rise are consultants who are already paid over £100,000 a year. And a lot of it was all publicity and PR stunts.
Oh, wow.